Rabies is a preventable viral disease that causes an inflammation of the brain. It exists in the saliva of mammals and is transmitted from animal to animal or from animal to human by biting or scratching. The virus can be spread when saliva enters an open wound through licking. Skunks, raccoons, foxes, and bats are the most commonly affected animals of the rabies virus. The rabies virus affects many of the young children in poor countries such as India. As shown by the age-sex pyramid in India, the population is currently in the second stage of demographic transition. In this stage, the population is growing rapidly. However, many of the young children are dying due to the rabies virus. Symptoms of rabies include fever, headache, and possible twitching around the bite area. Some have been known to experience hallucinations or agitation. Often, an infected victim experiences extreme irritability, bizarre or abnormal thoughts, muscle spasms, and/or difficulty speaking. As a victim enters the second stage of infection, symptoms may worsen to include double vision, problems moving facial muscles, and difficulty swallowing. The only effective method of treatment is prevention. 100% of all infected persons die unless the animal has been vaccinated prior to the event. A series of viral injections can be given to the human after the event, but even after this, the death rate still remains at 95%. Therefore, it remains vital that vaccinations, both veterinary and human, be given before the incident or attack. New oral vaccinations for raccoons have been produced. These vaccinations take the form of a bait, and when the raccoon bites into the fish meal crumbs, the vaccine is released into the mouth and throat. Most of these vaccinations can be released by planes into the desired area. The main problem with rabies is that most animals currently carrying the rabies virus are not domestic animals. Animals such as raccoons and foxes are primary carriers. However, it would be highly expensive to vaccinate these animals due to their untamed nature. The funding provided by the World Health Organization could help to vaccinate raccoons, foxes, and bats until the oral vaccine becomes more popular.